Last class we saw about diabetes mellitus and obesity. Today we are going to learn about cancer and AIDS. Cancer. Today the common disease what we hear about in the entire worldwide is cancer. Nearly 4 million deaths per year occurs due to cancer. Even in India, nearly 1 million people suffer from cancer. Cancer is a Latin word which means crab, which causes tumor. In Latin, the word oncos means tumor. So, study of cancer, you call it as oncology. Cancer. What is cancer? Cancer is an abnormal, uncontrolled cell division that invade and destroy the surrounding tissues also, forming a tumor, which is also called neoplasm. Neoplasm is new growth. It is nothing but heterogeneous group of cells, that is different types of cells that do not respond to the normal cell division. It occurs very fast, rapid cell division and uncontrolled abnormal cell division, that is cancer. This cancer cells migrate, it is not localized. It migrates to different parts of the body, and this movement of this cancer cells and affecting the new tissues is called metastasis. Metastasis is nothing but movement of the cancerous cells to different parts, migration of it to different parts of the body is metastasis. And usually the cancer affects the lungs, bones, liver, skin and brain. We have different types of cancer. One is benign cancer, that is non-malignant cancer, and the other is malignant cancer. When the cancer is specified or localized, does not spread to other parts, then you call it as benign tumor or non-malignant tumor. It is confined to a particular area, it does not spread, that is benign tumor. The next is malignant tumor, that is the mass of proliferating cells, that is the divided cells, start spreading to other parts of the body also, damaging the other normal tissues. So that is called malignant tumor. Then next is the cancer are also of different types based on the tissues from which they are formed, in which part of the tissue cancer occurs. Based on that, you have different types of cancer. You call it as carcinoma is one type. Carcinoma is a cancer that arises from epithelial cells and the glandular cell. Epithelial tissue and glandular tissue, if they are affected by cancer, it is called carcinoma. Nearly 85% of the cancer is due to this type, carcinoma type. It affects the skin, lungs, stomach, brain, etc. The next is when the cancer arises from the muscle tissues or connective tissues, you call it as sarcomas. When the cancer arises from muscle tissue or generally connective tissues, it is called sarcoma. Then nearly only 1% of cancers are sarcomas, and bones, cartilage and other connective tissues are affected. The next is leukemia. We all know that it is blood cancer where it causes an increase in the number of WBCs, white blood cells, abnormal increase in the WBCs, and it affects the bone marrow and lymph nodes. And then this is called blood cancer. This also affects children below 15 years have this leukemia. Then next is carcinogenic agents. The agents that cause cancer are called carcinogens or carcinogenic agents. These carcinogenic agents may be physical, chemical, biological agents or radiations. They coming to physical irritant, physical carcinogen, physical agent, smoking, causes lung cancer, and this there is betel chewing, smoking, snuffing. These are all physical agents that cause cancer. Then even excessive exposure to sunlight may cause skin cancer. Then chemical agents, we all know earlier just studied, nicotine, caffeine, and even the products that the products that come out along with smoke when we burn coal, oil, etc. They are all carcinogenic. And then pesticides, asbestos, nickel, even the artificial dyes or sweeteners what we use in cooking, they are also carcinogens. Then next, biological agents, it may be certain viruses that cause cancer. Some viruses may cause cancer, they are called oncogenic viruses. And then radiation, excessive exposure to radiations like X-rays, gamma rays may also cause cancer. So these are all the different carcinogenic agents. Then coming to treatment of cancer. Cancer treatment involves different steps based on the stage in which occurs. First, one is surgery. By doing surgery, operation panni and the particular cancer tumor mattu eduthulla, removing the cancer tumor by doing surgery. Next is radiation therapy. Tumor cells are irradiated to radiations. That is lethal doses of radiations, excessive exposure to radiation, so that the radiation will kill the cancer cells, so that we can come out of this disease. So that is, care to be taken that the normal cells should not be irradiated, because if they are irradiated, there is every chance of those cells becoming cancer cells. So precautionary irradiation therapy kills the cancer cells. Then chemotherapy, administration of anti-cancerous drugs through blood will kill the cancer cells. So that is called chemotherapy. Anti-cancerous drugs administered through blood. Then as IV. Then immunotherapy, medicines like interferon or antiviral proteins, they are introduced into our body. They are called biological response modifiers, because they increase our immunity so that we can fight to kill the cancer cells. We can avoid these cancer cells. So activating the immune system, our immune system, by taking drugs like interferons will destroy the tumors. Then preventive measures for cancer, that is awareness mainly that not to get exposed to such carcinogenic agents is the main preventive measure, and to avoid using tobacco, like smoking, avoid taking alcohol, consuming alcohols, avoid exposing to pollutants which may cause cancer, avoid exposing to radiations. X-ray, we say it's a method to study or diagnose a problem. But when we are exposed, prolonged exposure of X-rays even may cause cancer. When you go to a doctor, you may be prescribed or asked to take a blood test many times, but X-rays will not be recommended for unless or rather it is very necessary only we will be asked to take an X-ray. Then next disease what we are going to learn is AIDS, about AIDS, acquired immunodeficiency syndrome. We have learnt a lot even in our lower classes, and it is caused by a virus called human immunodeficiency virus. What it does is it affects our immune system, it destroys our immune system, suppresses our body disease fighting mechanism. That is what is immune system's work. And then it attacks the T lymphocytes, already we have learned. And then, so when the lymphocytes are destroyed, our immunity is lost, so we are prone to so many diseases to which we are exposed. Many virus or bacteria, whatever we come across, we will be susceptible to all such diseases because our immune system is suppressed. Then transmission of HIV. Already we have learned HIV is transmitted mainly through our body fluids, mainly by body fluids. Even in our tears, urine, saliva, breast milk, vaginal secretions, these HIV are found. Then how it is contracted, this HIV? It is how it is transmitted, mainly through sexual contact with an infected person. That is, it spreads mainly by sexual contact. But sexual contact with an infected person, and it may also be spread by use of contaminated needles, syringes, and so on. Where especially when taking intravenous drug abusers. Not only that, even in clinics, hospitals, when it is contaminated, when you use it, it spreads. And then by transfusion of blood without screening, if an that is when the blood from an infected person is administered, then there is every possibility of spreading this HIV. Then from an infected person to her child, infected mother to her child through the placenta. And not only through this, every possibility for transmission of this HIV by contaminated razors in salons. And then by tattooing, when we undergo tattooing, even then there is possibility if it is being done by a contaminated needle. So these are all the possible ways we know. So that is, now we know through which HIV spreads. Then symptoms and treatment of AIDS. Symptoms is why it is actually we become immunodeficient. That is the main symptom. So why we call it as a syndrome? We don't have a single symptom to say we suffer from this. We have so many symptoms. That is where when we are exposed to different viruses or bacteria, what all we are exposed, we get all such diseases, so that it becomes a syndrome. So swelling of lymph nodes, damage to brain, persistent fever, persistent cough, loss of memory, weight loss, chronic diarrhea, and so on. We have so many symptoms for this AIDS. Then diagnosis. How we test whether we have AIDS? We have two tests. One is ELISA, enzyme linked immunosorbent assay. The other is Western blot. This Western blot test is actually a confirmatory test for this AIDS. Then next is treatment. Although we don't have a strong treating medicine, at least we can prolong the life, and we can have the AIDS disease under control and prolong the lifetime of the patient for some time using this medicine treatment, that is a drug named antiretroviral drug, ARD we call it, antiretroviral drug. So that is administered for patients with HIV now, but it is not yet treated fully. Then prevention and control of AIDS. What are all the things what we saw in transmission that should be avoided? That is all. Mainly first, having safe sexual practices that will reduce the probability of AIDS. And then before blood transfusion, screening the blood whether it is negative, and then getting administered during blood transfusion. Then ensuring that we use disposable needles and syringes when we take injections in hospitals and clinics. And then creating an awareness, and then avoid tattooing. As I told, I am using sterilized or there is one-time use razors in salons. Also will avoid getting this disease. And then main thing is creating an awareness campaign and educating the people on the consequences of this disease will reduce the cases of AIDS. And AIDS doesn't spread through touch or contact of the person. So we should not isolate them. We should not avoid them. We should have them one among our society so that they will be psychologically healthy. So to lead a healthy lifestyle, as I told you from the previous classes, one thing is we should be aware of all these problems and should be as we are educated, knowing the consequences of all these problems, we should avoid such things and lead a healthy life.